So signs of sun damage can be variable. Often what people will notice is little red patches on the skin or rough patches on the skin that just don't go away. And this is a spectrum. So it starts off as sun damage and then if left over time can turn into an early skin cancer, which then turns into a more aggressive skin cancer. So we want to reverse it while it's at this early stage, so while it's just sun damage. Now, there are a few different ways we can treat these areas of sun damage. So we can use certain creams on those areas and sometimes even light treatments called photodynamic therapy, which are different special creams that are activated by either LED light and daylight treatments. It's important that we get onto these things early so that we're not progressing into skin cancer stage in a few years' time. So for most people, back of the hands is usually the worst. Back of the hands and forearms. For women, often the décolletage is a big area, and for men, face and scalp are all high-risk areas. And the reason we treat sun damage while they're in this area is because we don't want to be cutting skin cancers out of the face or head in future. There are multiple benefits of treating these areas of sun damage with topical treatments. So one, there's no needles, which is a big bonus. Two, convenience. So you manage this at home, you apply the cream on yourself, usually twice a day in a very thin layer. Three, cost, it's usually a modest cost compared to excisions needing to happen down the track. And four, it's often a scarless treatment. Versus getting something cut out, you may leave a scar there, versus these topical treatments will often be left without a scar. The process involved in using this cream is usually applying it twice a day in a very thin layer. Whilst you're using the cream, it can make the areas that are sun damaged come up a little bit more red and crusty and peel off. And usually once we've finished using the cream, can peel for about 1 to 2 weeks after you've finished as well. Now, whilst it may look terrible when you're doing the cream, the benefits strongly outweigh this. So usually once it's all peeled off, you'll have fresh new skin forming there, and a lot of patients come back say they look younger because they've got new smooth skin healing in that same spot. Once the treatment is done, for some patients that's all they'll need. Some patients with significant sun damage and ongoing sun damage may have to repeat this treatment every few years or so. Usually it's a milder reaction the following times that they do it.